Good afternoon. Thank you for joining us today. Lunch and Learn is a beginner's guide to anti-aging treatments. Aging graceful is a term most of us hear often, but what does that even mean and how do we accomplish that? Our speakers today are here from Bella Derma, a medical aesthetics and wellness office in Kansas City, to help us easily digest the secrets to an anti-aging regimen. Kelly Baker is the proud owner and founder of Bella Derma. She's a board-certified nurse practitioner with 16 years of experience in the medical field, ranging from critical care to family practice. Skylar is a registered nurse with 6 years of experience, ranging from critical care and medical aesthetics. Kelly and Skylar strive to help their patients find the best versions of themselves. If you have any questions today about our topic, please submit them using the question and answer feature. We will respond to them at the end of the presentation. And now, please join me in welcoming our experts, Kelly and Skylar.
Thank you and welcome. My name is Kelly Baker, and we are thrilled that you're here today spending some time with us. We're going to walk through a beginner's guide on how to achieve the best version of yourself. So before we get to introductions, I'd like to list our disclosures here on this slide and a little bit more about me. So I am a board-certified family nurse practitioner, and I received my undergraduate degree at the University of Missouri of Kansas City. I then went on to achieve my master's degree in nursing and board-certified in family practice. I did start my career here many years ago at North Kansas City Hospital, so it is near and dear to my heart. I am primarily only in aesthetic medicine at this point and have been since 2015, and I opened Bella Derma in 2018. This is Skylar.
Thanks, Kelly. Like Michelle mentioned, I am a registered nurse licensed here in the state of Missouri. I started my nursing career in the NICU at Children's Mercy and then have switched over to medical aesthetics full-time and have been on Kelly's team at Bella Derma since 2022. We are excited to be here with you guys today, and we understand that the world of medical aesthetic options can be very overwhelming. So our goal today is just to ease your minds, give you a place to start, and hopefully share some information that you didn't know before. So as we're diving deep into today's presentation, the big question is, where do I begin? Where do I start? And our best option, our best answer for you is an aesthetic consultation. That is an opportunity for you to sit one-on-one in a room with an aesthetic provider to discuss goals that you have for yourself, ask any questions you might have, explore different treatment options, what those options will look like. And it also gives you the opportunity to get to know your provider. Kelly likes to mention that that's a one-on-one interview for you to make sure that that provider is the right fit. And then, of course, at the end of all of that, your provider will help curate a plan that is unique to you. At Bella Derma, we offer a complimentary 60-minute aesthetic consultation to go over those concerns, ask your questions and goals. Like we mentioned before, we just want you to feel comfortable with your treatment options and confident with your results. We will dive a little bit deeper into what those aesthetic consultations are going to cover. But before I do that, I just want you to know that everybody is unique and treatment options are all individualized to you. We are just going to kind of go over these options quick, but please know that there are many other options that are on the board than what we will discuss today. And feel free to ask any questions about those at the end if you've got them. So first we're going to start with medical grade skincare, and we're going to start with these 2 daily habits that are important to our hearts here at Bella Derma. The first one is to make sure you're washing your face morning and night. Your overall skin health is really going to be dependent on this first easy step and making sure you are doing it twice a day. And then moving into wearing sunscreen every single day, rain or shine, whether you are working inside or outside. We always say sunscreen is the cheapest and most effective way to protect your skin, to protect yourself from those harmful UV rays, any pollutants that are in the air, and of course the radiation as well. So these are our 2, big hitters. If you are looking to begin and giving back to your skin, washing your face and wearing sunscreen is important. We kind of take a step up from there and dive a little bit deeper into some more active ingredient products. I know there's a lot of information on the screen here, but as we're starting to develop your skincare regimen, my personal recommendation to all of you is that you start with 2 active ingredients that are going to help you meet your skincare goals. These are 3 categories that we have kind of laid out for you today, but just please remember that there are many other options for you that you can further discuss in your consultation. My first one here is a growth factor. So as we age, we all know we start to lose the collagen production in our skin when we turn 20. So we need something to help our body stimulate that collagen. Growth factors are a great way to do that, to help that collagen and elastin stimulation, which will in turn improve wrinkles, fine lines, skin tone, and texture. Next active ingredient we move into is retinol, which is a derivative of vitamin A. This is more for skin rejuvenation. So we want to turn those skin cells over, bring healthy, bright, new skin to the forefront. So it's going to help repair sun damage, any pigmentation that you might have. It's going to help enhance skin tone, overall skin texture, and then of course also going to help diminish appearance of fine lines and wrinkles. Retinol is our number 1 recommended anti-aging product if it is something that your skin can tolerate. Last active ingredient that we recommend is an antioxidant. So we start to see premature signs of aging from exposure to environmental elements, things like the sun, smoke, pollutants that are in the air. Antioxidants are here to help neutralize those chemical reactions and protecting the skin from signs of aging. And while they're doing that, they're going to help brighten the skin, improve tone and texture. There are lots of different kinds of antioxidants that you can utilize, vitamin C being one of the most common. And just a great way to help brighten and freshen up the skin. So again, these are 3 active ingredient products that are good places to start. Not everybody may need all of these in their skincare regimen, but starting with at least 2 on top of washing your face and your sunscreen is a wonderful way to build that regimen up. As we kind of dive deep into medical grade skincare, we get asked a lot, why do I need to be using medical grade? You know, it's a bigger financial investment. Is it truly worth it? And the answer is yes. Medical grade products are researched and clinically studied to do what they say they will do. At Belloderma, this is the reason why we choose to carry medical grade, because we know offering you that medical grade product is going to get you the results that we are striving to achieve. Concentration of ingredients in medical grade is much higher, which means you'll need to use less product in order to reach those optimal results a little bit quicker. And of course, when you dive deep into a medical grade skincare line, you're going to find that there are many options that are targeted specifically to you and your individualized skincare goals. How you take care of your skin day to day is going to affect your treatment results. So as we start to dive deep into some other treatments, medical grade skincare is that place that we love to start because it's going to enhance those results and just make the overall skin health a little bit better. We want to help you build a routine that's going to protect that investment that you're making with these other treatment options. And we'll kind of keep diving deep into those treatment options here. Our first one is injectables. Neurotoxin is the medical drug category. Another common name that you might know is Botox, or some of you may have heard of Dysport. So as we kind of look at neurotoxins, what are they? Why are they important to our anti-aging regimen? Those fine lines, wrinkles that we see start to etch into our skin are all results of facial muscles contracting repeatedly over time. We like to compare that to a piece of paper being folded over and over and over again. You're going to notice that it forms a deeper crease into that page. So how do we end up softening those lines? We relax the muscle. Neurotoxins like Botox are injected into the muscle, again, to relax that muscle movement. It will allow for those fine lines to soften and give your skin a brighter, smoother appearance. We kind of look into how long will Botox last me. Got a picture here of what we like to call the Botox bell curve. Botox injections can last you anywhere from 3 to 4 months. Everybody's going to be a little bit different with how they metabolize that drug. Proper treatment duration of your results are going to be directly related to proper dosing and, of course, the placement of those injections by your aesthetic injector. When you get injected with Botox, you will not start to notice any difference until that first week after injections, and that's where you can kind of see the second bar on that graph there. You'll start to notice maybe about 50% of relaxation, and then at your 2-week point is that 100% relaxation. You're going to find that those muscles are relaxed for about 4 to 8 weeks. Again, everybody's a little bit different. And then you'll notice your muscles slowly starting to wake back up as you approach your 3 to 4 month mark, and that's how you know it's time to get your next treatment. Common question we get a lot is, how many units will I need? We hear a lot of our friends, family members, I get this many units. And we want to start by saying that dosing is variable. Everybody is a unique individual. Everybody's anatomy is different. Everybody's goals and outcomes are different. So from person to person, you will notice that your dose is different, and that is completely okay. It's important to share these aesthetic goals that you have with your provider, and they can go over areas that can be injected in order to reach those outcomes. You have to remember that your dose equals your duration. So in order to get that proper 3 to 4 months out of your treatment, you want to make sure that you're being dosed appropriately. We compare this to taking half of a Tylenol pill versus, taking the full dose. You're going to find longer relief of your pain from that full dose than you would if you just took half of it. Here are some before and after results we have from our injectors at Bella Derma. Botox is FDA approved for 3 areas. You'll notice on the left we have the frown lines, which are those lines that we call 11s that sit right in between the brows. We relax that muscle to help give the eyes a more open and awake appearance. Right in the middle there, we've got forehead lines. Again, that is caused by the forehead muscle, also known as the frontalis, lifting the brows up and down repeatedly, creating those horizontal lines. When we relax that muscle, you'll see that she's got a nice smooth appearance with those lines being gone. And then on the far right here, we've got the muscle that lays around the eye that creates lines that we call crow's feet. So when you inject around the eye, again, it just helps softens those lines to help her eyes look a little bit brighter, a little bit more awake. Our goal is to never change your appearance. It is just to help give you a natural, enhanced result. All right.
Thank you, Skylar. We'll be continuing our discussion with injectable options, and kind of to lead on this discussion of what Skylar just said, natural results are key. And so that is always going to be our goal for you. And a different approach to this is to use dermal fillers. So dermal fillers offer a non-surgical solution to really provide you with immediate, natural-looking results. And those common areas that are often treated are going to be the cheeks, the lips, lower face, and jawline. Depending on the area that's treated, as well as other factors that can be individualized, those treatment results should last on average from about 6 to 12 months. And what we love about dermal fillers is that they are very popular because the downtime is quite minimal, and they can be very customized to achieve those results. They are made from hyaluronic acid. That is a molecule that is hydrating and water-loving, and so it provides a lot of support, structure, and volume that is naturally already found in our skin. So we're mimicking what is already there and what oftentimes we lose with time. This next slide is a mother and daughter. Daughter is on the left, mother is on the right. I think this is a really great analogy that demonstrates age-related changes. With the mother on the right, she's still a very beautiful woman. She has beautiful glowing skin, but we can see some changes that have occurred due to age. There are supportive structures in the face. Most of that is going to be fat pads, as well as skeletal support that is lost with age, bone changing, and reabsorption. And what happens is the shadows that we see on her lower face and jowling and sagging of that skin really creates attention drawn to the lower half of her face. Where the daughter on the left, immediately, you see this youthful glow, but we're really focusing a lot of our attention up to her eyes, as the shape of her face is more heart-shaped, where her mother on the right is more square. We'll discuss some strategies that we use here at Belloderma to make recommendations to get those results that are natural and long-lasting. So with dermal fillers, a lot of the questions are, well, why would I get them? How do I know the right time? And is it just for the aging face? And although oftentimes it is because of age-related changes, there are things that can be done in your 20s and 30s and 40s to help slow the clock, right? We want to back the clock up so that we look our best for as long as possible. So really what dermal filler is meant to achieve is to restore volume from volume loss, like in the previous slide with fat loss and bone loss, as well as smoothing fine lines, commonly in the areas where the skin creases due to loss of elasticity, loss of collagen and elastin, where oftentimes those fine lines are around the mouth, known as the smile lines or smoker lines. And finally, also to enhance facial features. So this can be really not related to age changes just as much as what your aesthetic goals may be, to contour or slim the face, improve or increase light reflection on the top of the cheek, and subtle enhancements to the size and the shape of the lips. We can also place filler in areas to restore hollowness, which is commonly under the eye. These are some before and after pictures from our clients at Belloderma. The woman on the left had some under eye hollowing and just created some shadows and a dark cast under her eyes. So we did replace with small amounts of filler to change that under eye hollowness and give her some support in the under eye. So she immediately looks softer, more rested, and more youthful. The center photo is lip filler, and this was really to achieve lip fullness. She has a beautiful shape to her lips, but she wanted to see more hydration, and that's where hyaluronic acid filler can really achieve that. She certainly looks like she was born with those lips, and it's just meant, again, to provide some fullness. The picture on the right was also lip filler, and we were really, in this case, changing a little bit more of the shape while simultaneously providing some plump structure to the lip. So all those photos, in my opinion, really show natural results and are what is always intended with dermal filler. Again, this picture, these photos rather, show a journey across some time. And really what I would like to focus on is the top left photo is the client's before picture, followed by the picture to the far right, which is her end result. We are working together to achieve these results. Most of the time can be fairly immediate, but in some cases it is a journey, and we'll have multiple appointments, multiple sessions to achieve those natural results and do it in the most safe outcomes as well as optimal results for what you're looking for. So she had her under eyes treated as well as support established in her front of her cheek and the side profile of her cheek, as well as her jawline, her chin, and her lips. So what I want to, again, focus on is the fact that she still looks the same. It's still, Olivia is her name. So it's still Olivia in that after picture. It's just a softer, brighter, more youthful picture. And this woman was reported to be in her 30s. So again, age-related changes that are occurring in the usually the 20th decade with collagen loss. We're seeing that show up in the 30s and 40s. So time to act as soon as you can to achieve those results long term. And again, another before and after picture. This woman had some lower face changes, lower face sagging and jowling, and dermal filler was used to enhance the projection of her chin, as well as give her support across her jawline. So the before picture on the top left, as well as the after picture on the right, on the top and the bottom. So still very natural, not going to be artificial, and certainly nobody should really say anything to this woman other than, "You look great." So moving forward with other injectables, biostimulators are a great way to stimulate collagen from within. And there's a couple that we're going to talk about. There are many more, but these are the top two that we use at our office and we know the most about and feel that the outcomes are optimal and safe. So the first one is PRP. It's pretty popular right now. There's definitely a history with PRP. It has been used in medicine for decades. I think they first utilized it in the 1970s. So it's been around for a while, mostly in orthopedic realm as well as gynecology. But we use it to stimulate the skin renewal by triggering your body to make more growth factors to build collagen. So platelet-rich plasma is what that stands for, and it is done very easily in the office with a small blood sample that is taken, and we spin that and concentrate the platelets to then re-inject into the skin. So typically done in the under eyes, can also be done in the lower face. We do recommend treatments of about 3 to 6 to see those results. We space them out over many weeks to months, and collagen production and elastin stimulation does take some time. So your results are not seen immediately. It's a nice way, though, that is a non-chemical, natural way to achieve those results. And you will oftentimes see those results around 6 weeks and optimal results up to about 6 months later. PRP injections in the under eye really improve the under eye hollowness as well as the skin texture changes that occur with collagen loss and volume loss in the under eye. It's also a safe option, and I believe that in most cases it's safer than filler, and is primarily the route that our providers at our office choose for the under eye enhancement. We can also microneedle with PRP. Microneedling is a great way to stimulate collagen production across the entire face with microchannel injuries that we make with a device that is a very controlled injury that will allow your body to stimulate its own healing process. And PRP is an added benefit to grow those growth factors and build collagen and elastin. The second biostimulator is Sculptra that we use in our office, and Sculptra is a really powerful biostimulator. It is actually made from polylactic acid, which can create a response in the skin to form framework that helps support and maintain the skin's inner structure. It can lead to a much more youthful looking appearance and is a very natural way to do so. It improves the skin quality as well as just giving you that healthy radiance that we all are seeking in our treatments. Typically also done in a series of about 2 to 3 treatments spaced about a month apart. And results can be shown as early as 1 month and oftentimes continue to improve up to 2 years later. We follow this result oftentimes with a further discussion of other anti-aging treatments, which can include dermal filler and are commonly performed together to achieve that beautiful natural look. So diving right into wellness, at our practice, we do talk about anti-aging and wellness sometimes simultaneously, just trying to live the best life we can as long as possible. So we'll move on to discuss bioidentical hormone replacement therapy and medical-assisted weight loss. These topics are commonly discussed in the anti-aging realm, as I said, and I will also preface this discussion with this is a very brief overview, and you certainly should consider all options and discuss those with your healthcare provider to determine if this is appropriate for you. Hormones, what are they, right? I mean, we talk about them, but commonly we talk about testosterone and estrogen, but our body is made of hundreds of hormones that have chemical reactions to coordinate body functions, carrying messages to our organs, our skin, muscles, and other tissues. Hormones are essential. We need them. We couldn't do it without them, and they are an important, integral part of your health. So what do they do? Again, they help metabolism. They control growth and development, as well as keeping our body a happy place, and are an important role in sexual function, our sleep-wake cycles, and our overall mood. This next slide is outlining the most common symptoms that can be associated with hormone deficiency. I think a lot of us can attribute these symptoms to multitude of things, but can be your hormones, and certainly is a place to start that investigation process. But fatigue and lack of energy, as well as decreased mental focus, memory, feeling foggy, mood swings, certainly feelings of anxiety and depression can be associated with hormone loss, weight gain or just an inability to lose weight. Commonly, women describe hot flashes during those perimenopausal years and night sweats, but men can have night sweats as well. And decreased muscle strength, not getting the results that they're looking for when they're weight training, and just overall muscle and joint pain can be associated with this as well. And then decreased libido and sexual desire. So Bio-T is bioidentical testosterone and estrogen replacement therapy that we offer at our office. And this is a way to individualize therapy to each patient. We start with a laboratory evaluation that would include testosterone and estrogen levels, progesterone levels, as well as thyroid function, and vitamin levels. The collection that we get from you is just one puzzle piece. We also have a tailored approach to really dive into what those symptoms are that you're struggling with, and whether or not that could be coming from deficiency in hormones. So again, consultation is a very, very important piece to this, and certainly should not be overlooked. Lab evaluation is, again, just a puzzle piece to the big picture. Normal values, though, are not the same as optimal values. So being on hormone therapy and getting you to the optimal range is our goal to hopefully subsiding some of those symptoms that people are challenged with. Testosterone being the dominant sex hormone, both for men and for women. Of course, men make much, much more of this, but it is very important for both sexes. So we call male menopause andropause. So it's where the androgen production is decreased, and oftentimes that's pretty prevalent. 38% of males over 45 years of age do in fact have low testosterone levels, and more common in men who have chronic conditions such as diabetes, high blood pressure, and sleep apnea. And all those things that I just listed, as well as low testosterone, have all been linked to early heart disease. Further facts about testosterone, major major component to protect bones from osteoporosis, the brain from Alzheimer's dementia, breast cancer risk reduction, as well as heart disease, as stated above. And interesting to hear this, but sad as well, that men aged 30 to 70 will lose about 1 to 3% of production of testosterone every year. So cumulative effect by the time sometimes you're seeking treatment for that. And women as early as 20 years of age can lose up to 50% of it every year. The other dominant sex hormone is estrogen, both found in men and women. Menopause in women is actually defined as the termination of the woman's menstrual cycle after 12 months of absent menses. So although that may happen to you in later decades of life, it can actually show up with symptoms as early as 15 years before that. So most women are affected much earlier and attribute some of these day-to-day symptoms with just everyday life, but in fact can be related to estrogen loss. Most women don't actually ever, quote, get over it or, quote, get through it. And so menopause can be ongoing symptomatically to the end of life, really. So as we stated, present in men and women, has over 400 body functions. I think that's impressive, as well as controlling the major hot flashes in our life. It also protects our bones, our memory, and back to anti-aging of the face, actually has a big role in collagen production in our skin and is involved with increasing serotonin and dopamine hormones. Those are the hormones that make us feel happy. So hormone replacement therapy can be done in 2 different forms or methods, synthetically with pills, patches, and injectable forms, and the bioidentical plant-based natural forms of pills, patches, creams, and pellets. Pellets are what's preferred in our office, and that's how we replace bioidentical hormones, but that doesn't mean that's what's right for you. So delivery definitely matters. Oral route is really not favorable at all. Testosterone itself actually cannot be given safely that way, and oftentimes if it's given orally in the mucosa of the mouth, it has to be dosed very frequently, as well as transdermal, and most people really have a lot of skin irritation from that route, and the blood levels can vary dramatically. Injectable forms, again, with fluctuating levels and pain at the injection site, and there's several people who are actually allergic to the compounds found in the injectable and can also increase clotting risks by changing the way that our platelets stick together. So pellet forms really provide consistent blood levels. There may be a little bit of discomfort with the insertion itself, but oftentimes you have a better steady state and more of an even absorption. So naturally derived as well as long-lasting can last up to 4 to 6 months, and you would need to come back in to the office to repeat those pellet insertions, but just a few times a year. It is the most studied form of bioidentical hormone replacement, and as I stated, it provides an absorption that's at a steady stream and can be very individualized. I think that's also very important. Not one dose fits all, so it is very tailored to you, and is implanted under the skin, quite small, about the size of a grain of rice, and slowly absorbs and washes away with time. Briefly discuss our approach to medical-assisted weight loss. There's a lot of discussion about this in the community, and I think it's really so important to talk about weight loss as a journey. So in-depth office consultation, again, is going to be critical to your success, as well as the overall outcome and safety, to make sure you're on the most appropriate treatment plan for you. So we review your medical history, we discuss what you're currently eating and what your activity level is, and we can make adjustments and recommendations to that to provide you with macronutrient goals as well as activity goals to achieve those weight loss results. You would come into our office and also have biometric screening where we would look at body fat percentage as well as other markers that make up your total body weight, and a lab evaluation to make sure that you're otherwise healthy, that there's no other underlying conditions that need to be dealt with that definitely would impact what treatment plan is right for you. So the steps to determine the safe and most effective way is really to get you to the healthier and happiest place of your life is really to come in, have an office consultation, and discuss what those treatment options are and what's right for you. So I'll leave it at that. These are our references that we used for our presentation today. And we really want to thank you, really to spend some time with us today meant the world, and we want you to know that we are here and available for additional questions. You can certainly email us at the emails listed below, or better yet, call our office and make a consultation with us. You don't have anything to lose. We're really fun to be around, promise. Not a scary place, but we would really encourage, if you have further questions, make a consultation with us, and we'd love to see you. And this is our address of where our office is. It's in the Northland, just right off 152 and North Oak Traffic Way. And thank you very, very much for your time today.
That was so good. That was so interesting. I learned so much. Thank you. I appreciate you. The girls are going to flip over to some question and answers. I had a question myself, though. I have heard about like chemical peels. Tell me a little bit about like what is that? Who would that be good for?
It's a great question, Michelle, and it's multimodal approach. To achieve that reaction in the skin that we want collagen and elastin production to come from, as well as lightening some of the discoloration that we get from the sun over time. But it's a nice way to give you some exfoliation as well as boosting your skin's response to give us some collagen and production back in the skin. There's a lot of different levels of chemical peeling. There's superficial chemical peeling where you may not have a lot of skin shed, but you still get a great result. So a little less downtime than a medium depth peel that can actually cause some shedding of the skin and may have a few days of social downtime associated with that. But it's a great way to simply stimulate collagen, elastin, and lighten some discoloration.
I might need that. The only problem is the social downtime. I'll have to I'm not good at social downtime. We've got a couple of questions that have popped up here. It looks like somebody wanted to know downtime for some of those procedures. So what would be some of the downtime for like Botox? Can you go run 5K that day, or what do we do?
That is a great question. No, unfortunately, you cannot go run your 5K that same day. Normally after Botox injections, we recommend that you don't partake in any high intensity level workouts or do anything that's going to raise your body heat. So no saunas, hot tubs, things like that, just because Botox is heat sensitive, and we don't want to break down that product right after you have received the treatment. So for about 24 to 48 hours, we want you to be mindful of that. But really, alongside waiting for those 2 weeks for your results, there isn't a lot that you have to worry about with Botox. You can put makeup on directly after, you can go about your day as normal.
Okay, great, wonderful. Looks like we have a question. Somebody says, I have heard about another treatment called microneedling. What is that, and what type of skin does this help?
So microneedling is a treatment option for an anti-aging approach, again, to stimulate collagen and elastin. So we are creating with a special FDA-cleared device to penetrate little channels, micro channels into the skin to then initiate a healing response from your dermis. So this is going to bring all the rescue ambulances to that area to really give nutrients, growth factors to stimulate collagen. Minimal downtime, just a few days. You really wouldn't want to wear makeup for about 24 hours. But after that, a little bit of redness in the cheeks is really all to expect. Results are seen about 6 weeks after that treatment, usually done in a series of 3. But to stimulate that, that growth factor response, you do have to give your skin a very controlled injury to really see, kind of wake up the skin to activate is the best description I give people. Another analogy that makes sense for me, because I'm a very visual person, is when you aerate your lawn in the spring and fall and then overseed it, you get this luscious, beautiful green lawn. Same concept with the skin. So it's going to help with texture, fine lines, pore size reduction, as well as skin laxity. It should help tighten up the skin and over time improve the health of your skin.
Love that. I think I need that too. It looks like we've covered all the questions. Thank you so much for attending a beginner's guide to anti-aging treatments. We hope you found this information valuable. For more information on upcoming programs, please visit our website at www.nkch.org/classes. Thank you so much.